this video we'll talk about physiological tooth movement. So there are basically three things in which physiological tooth movement occurs. The first one being the eruption of teeth. The second one being the migration or drift of teeth. And the third one being during mastication. Now, a number of theories have been proposed to explain how the eruption of tooth actually occurs in the oral cavity. So you can remember them by the mnemonic burp, PHF. All right. Now, starting with the first one, which is B. So B stands for blood pressure theory. It states that the tissues around the tooth or around developing end of root, they are highly vascular. Now, due to this reason, there is an axial movement of the tooth. All right. Now, coming on to the second one, I. I stands for intrapulpal pressure theory. Now, this theory states that there is a variation in the pressure of pulp, all right, within the pulp cavity. So, basically, vascular pressure gradient within the pulp cavity. Now, the important point here to remember is if this pressure exceeds 9 mm of Hg, that causes the eruption of tooth. Now, this is frequently associated root formation, which causes bone resorption at apical area. All right. Now coming on to the third one, which is R. So R stands for root growth. Now this is very understandable. They usually propose that with the apical growth of the roots, there is an axially directed force which causes eruption of the tooth. Now, however, this theory also has a lot of drawbacks. The first drawback being that the teeth, they move at a greater distance during the eruption than the increase in length of root. All right. Now the second drawback being the second drawback being that the onset of the root growth and eruption, they do not coincide. As you all know, onset of root growth, basically if you have read DADH properly, so you will know that when a root is two-third formed and then only the tooth erupts. All right. So onset of root growth and eruption of the do not coincide. All right. Drawbacks. Third one, malformed teeth or teeth with no roots also erupt. All right. Now coming on to the fourth one, which is by B. So by B, we would say it is the alveolar bone growth. Now, this states that with the continued alveolar bone deposition and resorption, there occurs eruption of teeth with deposition and resorption. All right. Then this was the fourth one. Then we have PHF. So or PHC. So by P we have periodontal ligament traction theory. Now, this basically states that since PDL we all know is rich in fibroblast. Now, what happens is it causes the oblique fibers to contract. Oblique fibers contract, which causes the axial movement of the tooth. All right. Then the collagen fibers, they are aligned in optimum inclination and eruptive mechanism occurs. So by H we have Hamlock ligament theory. Now this was given by Schichter. Now what he believes is the band of the periodontal tissue has exists and it has fluid droplets. Now, what happens is these fluid droplets, when the force is applied, they degenerate against the band of the tissue and they cause the tooth to erupt. Alright, the seventh theory is the important one, PHF. So it is the dental follicle theory. This is the proved one, which means that in this theory, basically the tooth germ is removed and the follicle, it stimulates the eruption of the tooth. Now, second one which I told what type of physiological movement was the migration of the drift of teeth. Now this usually occurs when there is suppose missing tooth. So basically teeth have a tendency to move mesially to the space in order to fill it, all right, in order to close it. Now, usually anteriors have an inclination towards mesial and occlusal movement, whereas in mandible we see that there are variations. In maxilla, yeah, in mandible we see that there are variations. Now, the third one being the during mastication, physiological tooth movement. Now, during mastication, there occurs a cycle of forces in 1 second, which is equivalent to a force of 50 kgs. Now, during this, what happens is there occurs a tooth movement in the periodontal cavity, and after the remission of the force, it rearranges and the tooth goes back to its normal position. So, this is about the physiological tooth migration. Then we will talk about the physiological tooth. This is physiological tooth movement. Next time we will talk about pathological tooth migration in perio especially. So I hope I made it easy for you to understand and remember. Thanks for watching. Do subscribe to my